Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights, and today's webinar topic is the QIN-QIO 12th Scope of Work Update. Last week, we announced that this would be our final webinar in this series, but we are happy to report that this series has been extended. So we invite you to continue to join us each Wednesday for our weekly webinars. Next week's topic is staying current, key updates for immunizations and healthcare reporting. If you're interested in joining, that will be next Wednesday at 2 p.m. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. And now I'd like to introduce our speaker today, Penny Imes. Penny is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found her perfect combination for herself at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. Penny, thank you for joining us today.
Thank you, Kathy. And I would like to thank everyone on the call for joining us today. Our whole entire nursing home team is here, although, I am speaking for all of us today. We do recognize that many of you have been ongoing attendees at these webinars, and we want to let you know that we appreciate your attendance and we appreciate your participation. One of the reasons we wanted to have this webinar is because, of course, we sent out an email to all of our participants and partners on October 16th, announcing the end of the 12th scope of work with CMS on which ended on will end tomorrow, November 7th, 2024. And as we had stated in the email, the 13th scope of work contract is to be awarded in early 2025. We've since found out that the awards will be the end of February of 2025. When we have more information regarding what that next 5-year plan of work will look like, we will absolutely share that information with all of you. So at this point in time, we don't really have a lot of information to share for the 13th scope of work, but we did want to talk about what's going to happen between Friday, November 8th, and through March 7th of 2025. So there is a transitional period from November 8th, 2024 through March 7th, 2025, where we'll continue to work with our participants and partners, but most of our work will continue to focus more heavily on increasing vaccine rates, so the immunization work that we've been doing with you, and also assisting with infection control topics. As always, we are still here to assist with quality improvement, but as I said, with this transitional period, a lot of our focus, where CMS would like us to focus with you, is on continuing to help you with your immunization rates and those infection control topics. And we'll talk more about that a little bit later. So what this means is that we will continue through the transition period before the 13th scope of work is awarded at the end of February of next year. We will still be here at Quality Insights to support your projects. And all those things, like the last minute lowdown newsletter that we send out every week, are live chats that occur every Tuesday and Thursday at noon. And then these Wednesday webinars will continue. And we are going to have a question and answer session so that we can hear from you and hopefully get a little bit of feedback. But before we move into that, we did want to mention some of the work that we've done with you over the past 5 years, and really the improvements that you all have helped achieve within your nursing homes that CMS has recognized. So some of the work that we did in the 12th scope of work, there was around the opioid related adverse events. We saw with our partners, our nursing home partners, a 10.5% improvement in reducing those opioid related adverse events. There was from baseline, there was a 31% decrease in hospitalizations due to C. diff infection. And then there was a recognizable, notable increase in those COVID-19 vaccination rates among residents and staff. So over that period of time, of course, all the COVID work that we did with everybody, but then the vaccination rates. So there was from baseline, there was a 60% for residents and 36% relative improvement for staff, which are really good rates. And kudos to all of you, because we were there to support you, but we know the work that all of you put in to make that happen. And we really do appreciate that. So that's sort of what is happening right now in a nutshell. We're going to open up for questions and answers. We'd be very happy to hear from you, though, any specific infection control topics that you would like to see us continue to present during these Wednesday webinars. And I know when we do our evaluations after our educational webinars on these Wednesdays, we always ask you for your feedback and topic suggestions. And we've heard things like, continue to update us on the guidance, antibiotic stewardship, a few things like that have been mentioned before. And we always appreciate your feedback. So we were wondering today also, whether you have a question or not, if you have any feedback on the work that we've done in the 12th scope of work, or any projects related to infection control that you would really like to see us take a look at over the next couple months, we would really appreciate you letting us know about that. Before we move on to ask you for questions, I wanted to see if any of my team coworkers wanted to add anything, because of course we worked with you regionally in certain areas of the state. So if anyone wanted to say anything while we wait to hear if we have any questions from any of you. Looks like Patty.
Well, Penny, and some of you out there in the in the audience know, I can't resist having a chance to talk. So I'm super glad that I'm going to have the chance to continue to talk to all of you for the next several months until we see what happens with the 13th scope. But what I did want to say as it relates to infection control, we all know it's such an important topic, and we also all recognize how burned out you guys are on some of these topics. And we understand that sometimes we feel that way too. But we know that it is an important subject. We know that it is going to continue to be a focus for not only you, but for us. So what we're trying to do is look at some innovative and maybe previously unexplored ways or avenues with which to approach these kinds of topics. So if there is some little nuance or idea that you guys are exploring within your facilities, please let us know, and we would be happy to talk more about it, maybe expand upon it, maybe present it to others. We are, just like you, looking for ways to move that needle that seems unbudgeable at this time. So please keep the lines of communication over. And that takes me to my parting statement for today's call, is that those lines of communication, I will tell you that over the last 6 months, I have had so much fun in my region, actually looking at things from a non-emergency pandemic perspective and getting out there and getting down to the nitty-gritty of QAPI and solving problems with facilities in real time, looking for creative solutions. And you guys have made me feel a part of your team in so many cases, and I've learned so much from you guys. And I hope that I've been able to share a little bit as well. So if you are one of those facilities that maybe wasn't as engaged as you'd like to be in the future, let us know what you're looking for. If we're not providing that right now, we'll be happy to look at ways that we can meet your needs better. And if you are someone who has been a little bit more participatory and you found something particular helpful, speak up about that too, so that we can continue on that path. So looking forward to continuing down that same road and working with all of you. Thanks, Penny.
Thank you, Patty. Anyone else wanted to say anything before we move into the questions? Just want to give everybody an opportunity in case. Kathy, did you want to? I know you can either submit a question or, oh, there is a question.
There is a
Submit a
question.
question or.
I'll read it off. It says, with all the tag citations around infection control as top tags, what is specifically being cited? Meeting content, vaccinations?
I'm actually going to,
So Kathy, is that a
Yeah,
question for
the-
us, or is that a question for the group that you want to hear from them? What are they seeing as the top infection control deficiencies when Department of Health comes in? And you can unmute yourself, or Kathy, if you could unmute Kathy Durlitz so she can talk.
All right, Kathy, you should be able to unmute yourself.
Unmute. There, can you guys hear me okay?
Yes.
All right. Yeah, I'm just thinking, so it's continued to be in the top tags that have been cited, obviously, for over a year or better now. And I guess I just am trying to get into more detail about what specifically is still such an issue with as much training and education and availability, what we have. You know, is there a trend of what they're seeing? Is something not being covered in the minutes well, or are they not, you know, offering, and now that they changed the pricing, are they not offering people the vaccinations? I'm just curious what actually the top deficiencies really are when you get down to the nitty-gritty, just for education purposes.
So if anybody on the call is willing to share that information, we'd love to have you put it in the chat, or you can raise your hand and we can take you off of mute.
And one of the other things that's associated with that, and honestly, I'm drawing a blank, and I know Deb, we just got the letter. If there are deficiencies related to 880 and 887, where they do ask you to reach out to your QIO to assist. So we are definitely here and available to assist if you get deficiencies related to that. But yeah, we would be interested in hearing if anyone
I have
has
a
some input.
perspective on that. While I cannot tell you exactly what is being cited within each regulation, what I can tell you from my perspective is that infection control is something that is every minute of every single day in every single thing we do in the facilities, and we know that. So anytime a survey team is in your facility, regardless of the strength of your practice, there's a risk there because you have to be 100% all the time, right?
Yes.
So what we are seeing a little bit more frequently over the last maybe year or so is that repeat citations are being looked at and cited under QAPI. So if you are cited for something in infection control, make sure that you have a strong program that addresses that citation and that you are continuing to monitor that so you don't get hit with the repeat citation, the repeat tag. Only a perspective, not there's no data to support that, just anecdotal information.
Thank you, Patty. We have a comment that says use of transmission precautions, specifically EVP now, and then they added hand hygiene.
Good to know.
Great, thank you for your questions and comments. In that case, I think I'll run over some closing items unless anyone else on the panel has anything else to add on at this moment. If anybody has further questions or comments, please submit them using the chat or the Q&A tool in your Zoom menu, or you could raise your hand if you would like to ask your question out loud. While we're waiting, I'd again like to invite everyone to next week's webinar, which is called Staying Current, Key Updates for Immunizations and Healthcare Reporting, and that will be next Wednesday at 2 p.m. And if you're used to registering for these webinars in a big batch, like you register for multiple all at once, you may need to look and register again because we had to extend this series. So future webinars have been canceled and now they have been re-added. So if you are in the habit of joining each week, just look at those emails that we send or the last minute lowdown and make sure that you're registered if you would like to come to our webinars. Again, if you would like to come to any of our webinars or our office hours, you can find the times for that and the links in our newsletter called the Last Minute Lowdown, which goes out every Friday afternoon. And if you'd like to receive that newsletter, but don't think you're on the mailing list, you can email me at caudill@qualityinsights.org, and I will get you on that list. Now, I will drop my email in the chat. I see there is a question waiting here, or a couple comments. One said, vaccinations are offered and consent or declinations are signed. Informational sheets are given to residents and families, staff COVID education annually. Does anyone have anything on the panel to respond to that, or do I read the next one?
I think that was Robin. I think that was Robin responding to the previous question.
Okay, next question says, how are facilities to maintain urinary catheter bags when residents are up in a chair with the dignity bag? Historically, bags have been placed in a basin when seated in a low chair or low bed.
So, I mean, I can only speak on that one based on what I've seen in other facilities. And a lot of times your central supply company, you can order dignity bags that fit the catheter bags that you're using at your facility. I've also seen facilities have sewing groups make dignity bags that can go over, and then they're just laundered, and then there's all different patterns that the resident can pick. So it kind of matches their personality or their gender or something to cover the bag in a dignity bag. Those are the two things. I don't know, Jen, if you have any other. I've never really heard of the bag being placed in a basin when seated in a chair or a low bed, but I mean, I guess that's no different than putting the cover over them.
Yeah, I agree with what you said. It's something that
What
can
she
be.
said, there's a urinary bag inside a dignity bag placed in a basin, a recent citation. Oh.
Oh, that was a
Shonda.
recent citation.
Okay, Shonda, so we use fig leaf bag that have covers. We would place in basin to keep it off the floor. Oh yeah, Christine, I'd be interested in hearing more about the citation eventually.
I would wonder if you're in Western Pennsylvania. And this is going back, coming up on 10 years, but Western Pennsylvania has had a long history with dignity bags in low beds, coming in contact with the floor, and citations are automatically issued. And I can tell you that it isn't. Yes, Western PA. Okay. So it has been a topic that it's just like, how do you keep a dementia resident from standing from their wheelchair? It is a problem that is very difficult to solve. Same with the dignity bags that are suspended off the cross braces of the wheelchairs. They can't touch the floor, at least in Western Pennsylvania, because those germs will climb right up the dignity bag and up the catheter, and there you go. So I don't think it's a question that has a good answer. I think it's something that we just have to be continuously vigilant and creative when we're trying to come up with those solutions. I did many of basins on the floor as well. So I hear you. I would just recommend not using a trash container because it doesn't go well.
Yeah, Christine, and I knew Christine, I knew your name. I couldn't remember. Yeah, she worked with patient IP advisor with Patient Safety Authority, and she agreed with you and what you were saying, Patty. A dedicated clean basin, definitely. And Matt mentioned they stated as an infection control issue with potential increased entry access. That's Northeast PA. And I also, I mean, this is something that we can look into, Jennifer's RIP.
Yeah.
I don't know. The other thing with that is are they recommending leg bags? I mean, what is the,
Yeah, but you
I don't
can't neck
know.
bag
I'd
and
love
lay down.
I'd love to get more information about this situation because there's two issues here. With the urinary catheter, having it on the floor is a contamination issue. And then it has to be low enough so there's no backflow of the urine.
Right.
So, I'd love to get a little more information about this situation. And I'll be, okay, great. And I'll be happy to, dig into this. This is very interesting. Thank you. I'll reach out.
Yeah, I'm curious about the infection control issue with potential increased entry access. I mean, they have a catheter. Yes, there's. But they have to move around. That's kind of funny. And I see, to move on from that, and Jennifer will follow up, and whatever information we get related to that, we will make sure that we get it out there and share. And then I see another question came up. How do I convey to the DON, ADON, NHA that IP discipline regarding deviations by staff are not solely the IP responsibility? And again, I would say, I know, like, when Jennifer has done her infection prevention boot camp, where we've been teaching the basics of infection control, and then this also ties in to quality improvement and that culture of quality. And I know within the boot camps, Jennifer has invited more than just the IP. She's had some situations where a DON and IP from the same facility came together, and it really was an eye-opening experience. That is one of those things where perhaps we can and it's a culture of safety, a culture of quality is everyone's responsibility. I mean, that's the first thing. It takes a whole team effort. And you're absolutely correct, Hannah, that when there is something that is noted that is an issue, real time teach back, feedback is very effective, and the IP cannot be everywhere. But I think when you are involved in, and if your facility can participate, be involved in some of these boot camps, interventions, quality improvement programs that we try to assist you with, maybe we can help with that culture where everyone is part of the team and it's everyone's responsibility, not siloed into just the infection control person does that. Jen, I see you nodding. I don't know if you want to add more to
Yeah,
that.
so when we do our outreach to IPs, I always like to really stress that infection control is everybody's issue. It's really best tackled as a multidisciplinary approach, making sure that everyone knows their role in infection control, from upper management, from leadership, from frontline staff, CNAs, your housekeeping staff. Everybody has their very important role to play in infection control. And as the infection preventionist, you are sort of the leadership and management to let everyone know what their role is and how they should be implementing things. But it's not something you can do alone. And it can't be just your problem. So, communicating that as the leader of infection control for your facility is going to be really key. I just recently had someone put the IP role as they used an analogy I thought was really good. You should be the firefighter of your facility, not the police officer. Someone who comes in, to help kind of, manage what is happening, prevent things from happening in the future. But you shouldn't be the person who is sort of just walking around giving edicts to everyone. Everyone has their role to play in this scenario, and making sure that you have the policies and procedures in place, and your administrators and leadership have a key role. Those insights from the different departments are really important to making sure that everybody knows what they can do to help, and how they can help implement those policies. So, that's the advice I usually give, using that multidisciplinary approach to, impact the entire population there at your facility.
Thanks, Jen. That's good.
To
Good
add
information.
on to that, I have spoken with a facility who was having a very similar issue and was able to at least partially overcome it by including that infection control role into the job descriptions of all of the nursing staff. She probably could have taken it a step further, as Jen was saying, but they added infection control, a piece of infection control into all of the job descriptions, had everybody re-sign the job descriptions. Then the expectations were clearly, enumerated, and they had to be held accountable for their job description. So something to consider.
And we know
Yeah.
this is a continued focus. I mean, we lived through COVID. Infection control is even under more scrutiny. It's even more, it's always been important, but I think we understand even better now when the unexpected really did happen. And so it really, infection prevention and infection control will be a continued topic throughout the years. So you'll see more on that. And then, I just wanted to add too, if we don't have any other questions or comments, if anyone wants to follow up individually afterwards, send us an email, your project coordinator or whatever. If you need assistance with anything, please just let us know. We're just very happy that we're continuing to be here with all of you for the at least over, for the next up until March 7th, as far as we know. And then we'll see what happens in February when the 13th scope of work is awarded. But I can guarantee you infection control and infection prevention is going to be a big part of that for the next 5 years also.
Mhm.
Thank you, Penny, and thank you everyone for your questions. Does any of our panelists have anything they'd like to add before we wrap up and close out for today? Thank you, Kathleen. Thank you, Christine. All right, I'll go ahead and wrap us up then. Before we sign off, we'd like everyone here to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. That's another place where if you have suggestions for webinars that you would like us to hold, you can add that to the comments and we will see them when we download those results. I'd like to thank our nursing home team for joining us today. And I'd like to thank all of you for joining us today. And we hope to see you back here again soon.